إيش رأيكم؟
أكيد دكتورة.
Okay, excellent. Are you guys all muted or not?
لا مش muted.
All right, I'll share the screen again. We'll go back to our PowerPoint presentation. Just give me a few seconds to try to do you guys hear what to do with your music? Oh. والله أنا عارفة what's going on. Okay. All right, back to our PowerPoint presentation now. هاي ليش القد صغيرة؟ I'll try to make it.
دكتورة كأنك لغيتي الشير سكرين.
لغيته؟ Do you not see?
مش مبين لنا.
Okay. Share screen. Can you see it now?
هسه زبط.
Okay, excellent. هلا وصلنا احنا للvitamins. Okay. هلا what I would like to talk about next are the few most common causes of acute ataxia of childhood. The first cause, one of the commonest causes of acute ataxia of childhood is something called acute cerebellar ataxia of childhood, and this is what it's called as an entity. So this is the entity. It is called acute cerebellar ataxia of childhood. This is a post-infectious cerebellar ataxia, particularly with VZV infection, yani after chickenpox infection. ماشي? These patients typically will present a few days up to a week after the appearance of the exanthem or the rash. لكن أحيانا even they may present with ataxia after resolution of the rash. فبيكون في history of the exanthem. بيجوا هدول الأطفال they be indicated or required لكن أحيانا in severe cases especially when they are associated with mental status changes or when they are particularly severe we might do an MRI of the brain خصوصا إذا كانت even more prolonged. MRI may show cerebellar hyperintensities, okay? Although just like I mentioned in cases of ataxia with typical chickenpox there is really no need for MRI to make the diagnosis. In mild cases, these patients are discharged home. There is no need to admit them. Like in severe cases with significant vomiting, significant reduced oral intake, sometimes significant mental status changes, fever, they are admitted to the hospital. We typically, frequently in severe hospitalized cases, we might give them acyclovir and we might give them steroids. Like in الحقيقة, there is no evidence-based recommendations about either acyclovir or steroids. We provide them with supportive therapy and it generally has a good outcome, okay? So this is acute cerebellar ataxia of childhood. Remember in varicella zoster infection and chickenpox has significant neurological manifestations. The most important بالأطفال that we see هي acute cerebellitis, لكن we might even see acute meningoencephalitis. Varicella vasculopathy is a significant cause of varicella associated morbidity and mortality presenting with strokes, in addition to command the high risk for the development of myelitis, which is why vaccination for varicella zoster is actually very much recommended. It's not part of the national program in Jordan, I don't think. ولا صار part of the national program. يعني انتم يمكن تعرفوا أكثر مني.
صار
عفواً.
I guess إنه صار.
Yeah, it might be because it's been it's been discussed for a few years now. I'm not sure هلا صار part of the national program or not. لكن varicella zoster is not just a rash. It's not just the skin manifestations, which could be طبعا, as you know, they could be disfiguring. لكن there is significant كمان neurologic manifestations. But this is not كمان excluding a long-term neurologic manifestations such as herpetic neuralgia or post-herpetic pain. Okay. So these are some of the neurologic manifestations of varicella. The most, the least serious is the acute cerebellar ataxia of childhood. عندنا بالأردن we still see chickenpox infection, which is why every year we see probably 5 or 6 cases of acute cerebellar ataxia of childhood in relation to chickenpox. Okay, they have a history of chickenpox. They present with ataxia. In mild cases, just supportive therapy. They don't even need to be admitted to the hospital. In severe cases, they may need to have supportive therapy in addition to steroids and acyclovir. Any questions about acute cerebellar ataxia of childhood?
دكتورة ما بنعمل برين سي تي أو MRI بس عشان exclude other cause.
So in cases where you have the typical presentation, يعني المريض he has the chickenpox, he has the rash, diagnosed with chickenpox, and they present with ataxia, there is no need to perform neuroimaging. Like I mentioned, in cases where you have severe presentation, significant vomiting, prolonged presentation, then we might need to do an MRI. But most of the time, there really is no need to do an MRI of the brain. وعادة هدول, the ataxia improves very quickly. Yani for the most part, over the next 2-3 days after they present, they have dramatic improvement. So usually, no, it's not indicated. هلا you did ask about a CT scan. حكينا إحنا إنه the hyperintensities are present in the cerebellum, which is in the posterior fossa. So keep in mind that CT scan has very poor quality, very little yield in imaging of the posterior fossa. So if we are going to do an imaging of the brain in cerebellar diseases, it has to be an MRI of the brain. Okay? لما نعمل MRI, we usually see cerebellar hyperintensities, but it does not change the treatment, does not change the management or the diagnosis. All right? Okay. The other common cause of, so خلينا نحط هاي 1, just so you know that we're talking about the differential diagnosis of acute ataxia in childhood.
دكتورة في أي long term complication
For what?
للأكيوت ataxia?
No. With acute ataxia of childhood, there are usually no long-term complications. However, if the patient has a stroke or a meningoencephalitis, this is a different scenario. Okay? Acute cerebralitis causing acute cerebellar ataxia usually has a good outcome without long-term manifestations. However, stroke and vasculopathy طبعا could have more prolonged neurologic sequelae. Okay?
Okay.
Okay, number 2 is medications. The 3 medication classes that can typically present with ataxia are anti-epileptic medications, antihistamines, and sometimes, not ataxia, sometimes antiemetics. Dyskinesias can be mistaken for ataxia, or other movement disorders. Sometimes dyskinesias or extrapyramidal manifestations can look like ataxia, لكن the most أهم شيء هم anti-epileptics with antihistamines. Sometimes, someone in the family بياخد anti-epileptic medications. أحيانا even the patient himself has epilepsy with poor compliance. بياخده مرة, he skips a lot of doses. But then suddenly, the patient has a seizure. The parents start giving the medication more regularly all of a sudden. فشو بيجي المريض the patient ساعتها will present with side effects, including ataxia. So always ask about medication ingestion when someone presents with acute ataxia. This is the second important differential diagnosis. All right? Third very important differential diagnosis اللي هم CNS demyelinating diseases. There is an entity that is called acute demyelinating encephalomyelopathy, ADEM. What is
دكتور سمحت سؤال بس.
yes.
دكتور الانتيهستامين كيف بيعمل اتاكسيا؟ ايش الباثوفيسيولوجي تبعه؟
It's not true ataxia. It is lethargy, somnolence. بيجي مسطل يعني. Okay? هذا بيصير معه. Dizziness. Okay? This is how antihistamines present. So they present with unsteady gait. Like, of course, with antihistamines, this is a good question. You will not find true cerebellar ataxia. المريض ما راح يكون في عنده cerebellar signs such as nystagmus. Antiepileptics, however, present with typical cerebellar dysfunction. Okay? Antiepileptics, they are also toxic to the Purkinje cells of the cerebellum, and they can present with typical cerebellar signs. Antihistamines عادة بيجي lethargy, somnolence, and dizziness. Okay? Did I answer your question?
دكتور شكرا.
Okay. CNS demyelinating diseases. When you hear this description about white matter demyelination, what do you think of? في شيء ثاني بخطر على بالكم? Is there a disease that you know that causes white matter demyelination?
Guillain-Barré.
Like Guillain-Barré is demyelination. صحيح إنه نفكر بGuillain-Barré, but it is demyelination of the peripheral nervous system. What about
multiple sclerosis?
Multiple sclerosis, yes. So acute demyelinating encephalomyopathy is one of the CNS demyelinating diseases. اللي part of that family is multiple sclerosis. ADEM is usually different from multiple sclerosis. And it is a monophasic disease, okay? Frequently following preceding infections, okay? Monophasic disease, and they also present with a fulminant presentation, including, and you must have mental status changes. Adora, always present. Mashi. You can have low-grade fever. You can have focal neurological signs, including ataxia, طبعا. Even focal seizures, ماشي الحال. And MRI will show a typical. MRI shows typical. They are more fulminant, larger, demyelinating lesions, okay? Sometimes involving deep gray matter, which is different than multiple sclerosis that only involves the white matter, okay? And CSF shows a leukocytosis, okay? Again, ADEM is, it's not a common pediatric disease, like it's something that we see every year, probably again, 2 to 3 times, we see acute demyelinating encephalomyelopathy affecting the brain, the encephalo, and أحيانا the spinal cord, which is why it's called encephalomyelopathy. MRI is always abnormal, and it's different than acute cerebellar ataxia of childhood, that there is no history of chickenpox. Very suggestive is the presence of mental status changes and focal neurological signs. This is when we think of acute demyelinating encephalomyelopathy, and it is diagnosed by performing an MRI of the brain, okay? And it's treated usually with immune modulation, such as IVIG or plasma exchange, okay? And it's usually monophasic, just an acute presentation without recurrence, which is also different than multiple sclerosis. اللي اسمها multiple because you have multiple attacks, صح? So this is another important differential diagnosis of acute ataxia And indeed, ADEM is an important differential diagnosis of any acute focal neurological manifestation or decompensation. Okay? Any question?
دكتورة يعني ما بصير في irreversible damage هون ولا كيف؟
They can, لأنه it is a variable severity. So you can have a mild demyelination with encephalomyelopathy with only demyelinating lesions. Like in severe cases, it can be hemorrhagic and necrotizing. So sometimes with severe inflammation, you can have long-term neurological sequelae. Like in most of the time, نقدر نحكي up to maybe 85% of the cases, you can have complete recovery.
دكتورة هسا
Yes.
يعني الديمايلينيتنج يعني هسا المايلين شيث اللي بيكون في النيورون بيروح ولا كيف؟ مش فاهم ايش هو الديمايلينيتنج.
Yes, you have inflammation, you have antibodies attaching. So it's a form of molecular mimicry. If you can remember this term, بتذكريها من الفيزيولوجي أو الpathology, molecular mimicry, which is when the autoimmune system mistakes its own tissue for a foreign tissue. فبصير في عندك an autoimmune disease. Okay. But you start having antibody complexes and activation of the complement system, leading to, yes, inflammation and, demyelination. Okay? جاوبت على سؤالك؟
دكتور
Okay.
شكراً.
Autoimmune disease. Okay, this is the pathophysiology of ADEM, acute demyelinating encephalomyelopathy. Okay, let me talk about another case عشان نحكي عن the third ولا fourth fourth important differential diagnosis. You have a 13-year-old subacute onset of unsteady gait. She's found to have areflexia. شو بتعرفوا disease that can cause loss of reflexes? Loss of reflexes. When you have areflexia, do you think of upper or lower motor neuron disease?
lower
Lower motor neuron disease. So we should consider a variant of Guillain-Barré syndrome. أخذتوا المحاضرة عن Guillain-Barré ولا لا؟
يس خلنا راند.
أخذتوا يعني شيء اسمه Miller-Fisher syndrome. Miller-Fisher is a variant of Guillain-Barré. Patients with Miller-Fisher syndrome present with a triad of ataxia, areflexia, and ophthalmoplegia. Okay, a triad. So هدول مرضى الميلر-فيشر, they don't present with weakness زي مرضى الجيليان-بري. They present with ataxia, areflexia, and ophthalmoplegia. Okay, so this is another important differential diagnosis. خلينا نحكي. نسميه number 3 Miller. لا number 4 نحن صح؟ syndrome. Okay, it's also a variant of Guillain-Barré disease. عادة we treat it just like Guillain-Barré. Treatment is immune modulation with either IVIG or plasma exchange. Okay, this is Miller-Fisher syndrome. ماشي الحال؟ And it is autoimmune طبعا, post-infectious, just like Guillain-Barré syndrome.
دكتورة ممكن سؤال عن ميلر فيشر؟
Yes, تفضل.
في له specific antibodies هذول ممكن يساعدونا بالdiagnosis؟
Yes, it is associated mostly Miller-Fisher associated with GQ1B. GQ1B. I think لازم هاي كمان تكون small. GQ1B anti-ganglioside antibodies. Yes. Okay. لكن هدول they are transient. They are not present in all of the cases. So it's difficult to it's difficult to rely on these antibodies for making the diagnosis. But they could be present. Okay?
تمام شكرا.
Post-infectious. Mostly هدول الكامبيلوباكتر جيجوناي هم اللي بيكون عندهم GQ1B antibodies, anti-ganglioside antibodies, and it's autoimmune. This is Miller-Fisher syndrome. And just like Guillain-Barré syndrome, usually it has a good prognosis in children, and it is monophasic with gradual improvement. Okay, Miller-Fisher syndrome. طبعا if you notice يعني outside عدا عن مرضى chicken pox, all of these patients with acute ataxia, شو investigation اللي universally رح نعمل لهم إياه؟ MRI of the brain, right? So any patient with acute ataxia, unless we firmly believe, very strongly believe that this is varicella-induced or acute cerebellar ataxia of childhood, unless we think that's what's going on, they invariably will get an MRI of the brain. Okay? So this is differential diagnosis number 4. And continuing on with our differential diagnosis.
دكتورة بالنسبة للجوليان-باري بيسوي
سؤال الجوليان-باري بعدين اللي بعدك تفضل.
دكتور ممكن ترجع سلايد والله بس اخذ
This one? If you this one?
دكتورة بس سؤال الجوليان-باري بس بدي أسأل مش بنسوي electrophysiologic study.
Yes, of course. You could do an electrophysiological study. The problem with Guillain-Barré up to 7 days at least of presentation. Additionally, in this case where you don't have peripheral nerve, you don't have weakness, sometimes it's difficult to find evidence of demyelination on the peripheral nerves. Okay? هاي هي المشكلة. عادة هدول Miller-Fisher syndrome of the ganglia, okay, dorsal root ganglia. So when you have demyelination at the level of the dorsal root ganglia, أحياناً when you do electrophysiological studies of the peripheral nerve, you don't find evidence of demyelination. In addition, it takes at least 10 days before you find evidence of demyelination, even in Guillain-Barré syndrome. Okay?
Okay, thank you.
So oftentimes we depend on the clinical picture and طبعاً doing an MRI, ruling out a central nervous system structural disease.
Okay.
The 5th important differential diagnosis is stroke. ماشي. Where do you expect the stroke to be? In someone with ataxia? Cerebellar stroke, right?
Yes.
Or hemorrhage. This is the other differential diagnosis. We have to remember auto or vasculitis, such as SLE, ماشي, neurological manifestations. Again, MRI of the brain will be diagnostic, and with vasculitis and SLE, we will also typically find MRI changes. Okay?
Stroke common in children ولا لا؟
Yes, of course. It's not common in children, لكن it has a completely different pathophysiology than adults. طبعا stroke is a completely it's a big topic that needs a dedicated session. But yes, stroke in children is definitely a differential diagnosis for acute neurologic manifestations. مثلا if we want to speak just بس نعطيكم فكرة عن stroke in children. For example, children at risk for stroke include children with hemoglobinopathies, such as sickle cell disease, children with congenital heart diseases, all right? هدول هم children at risk for having acute strokes, okay? 6 is vasculitis. 7 is the paraneoplastic syndrome. It's not common, it's quite rare. اسمه opsoclonus myoclonus syndrome. This is a paraneoplastic syndrome in relation to the presence of a neuroblastoma. So what we need to do is a CT of the chest and abdomen to look for a neuroblastoma when a patient presents with opsoclonus myoclonus syndrome. Okay, opsoclonus are conjugate, dancing-like, jerky eye movements. Myoclonus is myoclonic movements of the limbs. This is a paraneoplastic disease. One of you asked about inborn errors of metabolism and hereditary diseases. اليوم our talk is about acute ataxia. Usually, inborn errors of metabolism present with a chronic progressive deterioration. Like sometimes some inborn errors of metabolism present in a recurrent fashion. So with acute ataxia, this may be the first presentation of a recurrent ataxia. For example, in patients with maple syrup urine disease as an inborn error of metabolism, or patients with channelopathies, potassium channelopathies, calcium channelopathies, who can present with episodic ataxia. So this could be the first presentation of a recurrent problem. مفهومة هاي القضية؟
تمام دكتورة يسلم.
دكتورة فريدريك ataxia برضه نفس الشيء.
لا Friedreich's ataxia presents in a subacute and chronic manner. يعني you will not see a Friedreich's ataxia patient presenting acutely. They all present in a slowly progressive manner. So it's not on the differential diagnosis of acute ataxia. Like in some inborn errors of metabolism, because metabolic diseases, their presentation depends on presentation of metabolic diseases depends on the degree of enzyme deficiency. Okay? If it's severely deficient, it presents very early with loss of milestones and progressive course. If it is mildly deficient, ممكن يصير عندهم شوية developmental delay. وأحيانا بيكون الديفيشنسي يعني على الحفة between 10 and 15% of the enzyme. So they start having acute manifestations with illnesses or fever or dehydration. Okay? فبرشح المريض بصير عنده الانزيم ببطل يكفي لانه he's decompensated, there's increased demand, increased metabolism. The enzyme cannot keep up, so they present in an acute fashion احيانا with ataxia. مفهومة هاي القضية؟
Yes, دكتور يسلم.
Okay, so I know a lot of the things that we talked about يعني are not familiar to you, but I think it's an excellent thing, and now you're being familiarized to many of these disease processes. Like I mentioned, if you invest in the time to look up some videos about examination, and also invest in maybe reading about some of the differences that we talked about, it would be excellent. Okay, it would maximize your benefit from this presentation. Okay.
دكتورة ممكن تعطينا السلايدات هدول؟
Yes, أنا هلا I will upload these slides or upload the slides for the febrile seizures. Although I think maybe I did show the febrile seizures, but I'll upload both. Excellent, thank you.
Thank you.